Assalamualaikum and hi, my name is Aimi Raihanah Binti Ramlan. My matrix number is BM25110037, and today I'm going to be talking about cardiology, which is a branch of medicine that specializes in diagnosing and treating diseases of the heart, blood vessels, and circulatory system. So, in a much simpler way, it is a field of study that mainly focuses on heart and anything that is related to it. So, first, what is a heart? A heart is a vital fist-sized muscular organ that acts as the body's pump, circulating blood, oxygen, and nutrients through the circulatory system to all organs and tissues, while also removing waste like carbon dioxide. So, moving on. Next, we have specialists. Just like any other field of studies, the cardiology field itself has a lot of great specialists, or what we know as cardiologists. And one of the best example is Dr. Alain Cribier, which is a French cardiologist born in 1945 in Paris, France. Some educational background about him is that he used to attend the Charlemagne Lycée to finish his high school studies before continuing his studies in medicine in University of Paris. Just like any other cardiologist, he also have some great contribution that he has done to the cardiology field itself. A few example is that he was the first one to perform the balloon valvuloplasty for calcific aortic stenosis back in 1986. And after that, he established a percutaneous valve technologies to develop his visions in percutaneous aortic valve replacement. And back in 2002, he was the first person to perform the transcatheter aortic valve replacement TAVR in the world. And last but not least, he also developed the metallic commissuratum in order to improve the cost efficacy of mitral valvuloplasty. So next part I'm gonna explaining about the anatomy of the heart, and it has 4 parts that I'm gonna be explained, which is the pericardium, vessels, chambers, and also valves. So first, I'm going to be explaining about the pericardium, which is a layer that cover our heart. It has 2 layers, which is fibrous pericardium and serous pericardium. So based on this picture, we can see that the fibrous pericardium is the outermost layer, and right under it is the serous pericardium. Next, we have vessels. So our heart actually have 4 types of vessels, which is the vena cava, aorta, pulmonary artery, and pulmonary veins. But the vena cava is split into 2, which is the superior, the upper part, and the inferior, the lower part. So as you guys can see in this picture, this one up here is the superior vena cava, and this one right below the right atrium is the inferior vena cava. And then you have the aorta, which is the largest arteries in our body. And then you have the pulmonary artery, this one, and the pulmonary vein, this one. Okay, next we have the valves. Our heart actually consists of 4 types of valves, which is the tricuspid valve, pulmonary valve, mitral valve, and aortic valve. So the tricuspid valve is actually located between the right atrium and the right ventricle, whereas the pulmonary valve is located between the right ventricle and the pulmonary artery. Next, we have the mitral, or what we know as bicuspid valve. It is located between the left atrium and left ventricle, this one right here. And last valve is we have the aortic valve, which is located between the aorta and the left ventricle, this one right here. So next, I'm going to be explaining about chambers of the heart. So our heart actually split into 4 chambers, which is the right atrium, this one, the right ventricle, this one, the left atrium, this one, and then the left ventricle, this one. So after explaining about the anatomy of the heart, I'm going to be explaining about the physiology of the heart. So it actually has a lot of points, but a lot of things about the physiology, but today I'm just going to explaining the 2 points, which is the ECG and the autonomic nervous system. So first, the ECG. The P wave is caused by spread of depolarization through the atria, then followed by atrial contraction that causes a slight rise in atrial pressure curve. So as we can see here in the picture, this is the P wave. And right after P wave, we have the QRS wave, the QRS path, which appear 0.16 seconds after P wave due to electrical depolarization of ventricle that causes ventricle to contract and raise ventricular pressure. So after the PQRS, we have the T wave, which actually represents the stage of repolarization of ventricles when the ventricular muscles fibers begin to relax. So then other point is about the autonomic nervous system that is that's main function is to regulate our heart rate, control our heart rate. So we have the autonomic nervous system is split into two, which is the parasympathetic and the sympathetic. So first one, the parasympathetic, it is actually via the vagus nerve, this one. So it synapses with the postganglionic cells in the sinoatrial node (SAN) and atrioventricular node (AVN). So the acetylcholine will bind onto M2 receptors, which as act to decrease the slope of the pacemaker potential, thus decrease our heart rate. Next, we have the sympathetic pathway, which is via the postganglionic fibers from the superficial and deep cardiac plexuses, which innervate the SAN, sinoatrial node, and AVN, atrioventricular node. It will release noradrenaline, which acts on B1 adrenoreceptors to increase the slope of pacemaker potential, thus will help to increase our heart rate. So in a much simpler way, this parasympathetic will decrease our heart rate, while the sympathetic one will increase our heart rate, and also as well as increase the force of contraction of our heart. Okay, next I'm going to be explaining about the biochemistry of the heart. So just like the physiology, it has a lot of points, but I'm going to be explaining about the cardiac metabolism and cardiac excitation contraction coupling. So the cardiac metabolism mainly focus about the ATP, how it is used, how it is generated, and what it is mainly came from. So the ATP, which is adenosine triphosphate, is the primary energy source for the heart, which is used to fuel heart's activities. 95% of ATP generated is by oxidative phosphorylation, while the other 5% is through glycolysis and Krebs cycle. 60 to 70% of ATP is used for heart muscle contraction, whereas the 30 to 40% is used for ion pumps. And 70 to 90% of cardiac ATP actually came from fatty acids, while the remaining actually came from glucose, lactate, ketone bodies, and other amino acids. Next, about the cardiac excitation contraction coupling, which is mainly focused about how the action potential can causes muscle contraction. So it involves the action potential itself, these calcium channels, the calcium ions itself, the troponin, the myosin, and how it actually causes contraction. So this part I'm going to be explaining about disease and technology that is related to the heart. So first, the disease is I'm going to be talking about coronary artery disease, which is due to atherosclerosis, the hardening of arteries due to plaque building up inside the arteries. Well, the plaque, as we can see here, is made of fibrin, lipid, some waste products, and also cholesterol. So, for someone who have this disease, the CAD disease, coronary artery disease, they will experience some symptoms like angina, chest pain, or dyspnea, shortness of breath. So, who is the people that have high risk to get this type of disease? So, anyone who has high cholesterol level, who is obesity, diabetes, and anyone who is smoking is actually have a high risk to get this coronary artery disease. So, next I'll be talking about angioplasty, which is a technology used to treat this disease. Angioplasty is actually a procedure that opens the arteries to let blood flow more easily. As we can see in this picture here, it is an overview of step by step of angioplasty. So this shows the CAD disease itself. Then anyone that undergo angioplasty will have a balloon being inserted into the blocked artery. Oh, and the balloon will be inflated to expand the stent. And after it's been expanded, the balloon will be removed to let the blood flow smoothly through the arteries. So, anyone who undergo angioplasty actually face some type of risk, which is allergic reaction, maybe due to dye or anesthetic that has been used. They may also feel pain, bleeding, or infection when a needle or catheter went into the skin. They may also somehow get blood clots, and worst of all, they may somehow experience heart attack. So, in conclusion, learning cardiology actually helps us understand how the heart works and what happens when it becomes sick. It, be, it, it connects basic science with real patient care, such as understanding symptoms, ECGs, and heart disease. Because heart disease is very common and serious, learning cardiology is important for saving lives and improving patient health. That is all from me. Thank you.